Hey everybody, Matt Johnston here, and I'm back with another COVID-19 legal update. Lots of stuff happening both at the state and federal level, largely related to vaccine programs and things of that nature. So our good friends at the OSHA, the Occupational Safety and Health Administration, have decided this is a good time to issue some new guidance. Now, I do want to stress that this is guidance only. It's not law, it's not regulation, it is not even interpretation of a regulation. It is simply some helpful suggestions from our friends at the United States Department of Labor. So, let's start off with a couple of things. Number one, vaccines are starting to be administered. Everybody's happy about that. If you want to have a discussion about the moral and ethical implications of who gets chosen to get the vaccine first, hey, give me a call because that's a fun discussion to have. But as workers start to get the vaccine, bear in mind that simply because you have a vaccine does not mean you are immune, nor does it mean that your coworkers are immune. So I need everybody to understand that just because vaccines are being distributed and some people are getting vaccines, employers are still required to maintain a good, healthy, safe workplace. And that means all of the protocols that we've been following for the past, 10 months now, including social distancing, wearing masks, physical barriers, changes in workplace workflow, things of that nature still apply and still should be used by employers and employees. Number two, if you have been largely working remotely in your workplace and now the vaccines are becoming available, you are planning to bring workers back into the office, congratulations. However, it is still an employer's obligation to maintain a safe workplace free from hazards or reasonably free from hazards that could make somebody injured, sick, or otherwise subject to lack of safety. So if you are an employer, I strongly recommend you appoint a person who is going to be your COVID-19 safety, administrator. I guess that's the best word for it. Somebody's going to be responsible for developing a workplace safety plan. That workplace safety plan should include things like maintaining distancing, masking, cleaning and sanitizing protocols for all employees. You should also speak to your employees. Employees are often very, very good at figuring out how they could get hurt, sick or otherwise, so please bear that in mind. You are still going to be required to maintain safety, and if that means teleworking, maintain teleworking. You may also want to address the concerns and risks associated with certain individuals who may be more prone to contracting COVID. We've talked about this before in many other videos. So folks who have a disability, who have respiratory conditions, who are older, these are folks that you may want to consider a plan for. However, and I want to make this very, very clear, you cannot discriminate against these people. You may need to provide an accommodation, which might mean teleworking, might mean working someplace else in the office, something along those lines. But you can't single out, say, for example, older people and tell them they have to work from home when nobody else does. So those kinds of things you can't require, but you can make those things available. And in your workplace safety plan, you should make them available to all employees as a sort of a general suggestion or general possibility or general availability of some alternative methods. If somebody asks you for an accommodation under the Americans with Disabilities Act, you are required to do so unless there is an undue burden placed upon the employer. So the last thing that I want to bring to everybody's attention when you're dealing with a workplace safety plan is make sure it is communicated to all your employees in a language they can understand. Okay, so what does that mean? Number one, it means don't have a lawyer drafted up in uber legalese. Most people don't understand legalese. Quite frankly, sometimes I don't understand legalese. So draft it in a way that your average worker can understand. If you have a large contingent of workers for whom English is a second language, you may want to consider getting it translated into a language that they can understand. Google Translate works pretty good. But if you happen to have somebody who speaks the language a little bit better than that, you may want to consider having it translated. Some documents are available from the state and from OSHA in Spanish. Sometimes they're available in other languages, so please take a look around for those options. So, if you are going to have workers coming back into work, remember, vaccine does not equal immunity. You still need to maintain your distances and your social distancing protocols, masking, things of that nature. You should have a workplace safety plan, and you should designate somebody in your company who is primarily responsible for doing that, and make sure you have plans for those workers who are more susceptible, and communicate that plan to your workers in a language they best understand. In the meantime, the links to the OSHA guidance are down below. It's a bit of a lengthy document, but it's helpful. Lots and lots of information, and oh yeah, lots of links to various other sorts of guidance. So remember, this OSHA issuance is just guidance. It is not regulation, and it is not required. And in the meantime, stay safe out there, and we will talk to you later. Bye-bye.